Hi, my name is Lily, and today for my career report, I will be talking about healthcare department manager. Um, I chose this career specifically because I've always loved anything having to do with the medical field, and I actually do have a background in it myself. I went through BOCES, and I got 2 separate certifications as a medical assistant and nurse assistant. Okay, so we're going to get started. We're going to start with the table of contents. So here I just have a job description, salary and benefits, working conditions and hours, and a hiring outlook for this career. So we're going to start with, what does the healthcare department manager do? So they have a few tasks, like in particular, that most of them do. Some of them are develop departmental goals and objectives, ensure that the facility is up to date and compliant with laws and regulations, recruit, train, and supervise staff and members, manage the finances of the facility, create work schedules, and monitor budget. Along with those things, they do a few others, such as represent the facility at investor meetings or on government boards. They keep and organize records of the facility services, such as a number of inpatient beds used for a certain date or period of time, and communicate with members of the medical staff and department heads. Healthcare managers, department managers can also be referred to as healthcare executives or healthcare administrators. Now we're going to go on to an education. So normally a bachelor's degree at least is needed to get this position. Master's degrees are preferred by employers though. It is most likely to not have one single degree to get this job. So you could have a degree in health administration, health management, nursing, public health administration, or any business administration. Any degree that focuses on management and healthcare, combines business-related courses with course in medical terminology, hospital organization, and healthcare information systems would work well. So now we are going to go on to salary and benefits. So in the United States, one can earn an annual average salary of $101,340. The range can also be anywhere between $55,470 each year to $165,400 annually. Pharmaceutical manufacturers are usually the ones that take home the biggest sum on the scale. So they take home normally $165,400. And normally when you're just starting out as a leadership position, in this field, they shouldn't expect to be anywhere higher than the bottom 10% of this profession. So that could be in the lower percentage of the average in the range. So there are a few benefits to this job and this career. There are numerous emotional benefits. So not all careers can offer such a fulfilling and rewarding career, but working as a healthcare administrator does. They can create a positive impact by devising policies that ensure their organizers and organizations operates with its patients' best interest in mind. And they also have access to other job opportunities. So healthcare admins aren't usually restricted to solely working for a healthcare organization. They can also choose later in their careers to go work for government agencies or go work for themselves as a management consultant. There are very few things that this one profession cannot do. Okay, now we're going to talk about workplace conditions and hours. So we're going to start by saying that they always work indoors in offices, hospitals, and other healthcare facilities. And then next, occasionally they're exposed to diseases or infections. Normally this is only a risk when they're interacting with the patient directly, and may on occasion wear safety gear such as gloves and masks, and obviously now more so the masks and any other protective, personal protective equipment, PPE, due to COVID. They work near others and they may share the same office space on occasion. And generally, healthcare managers work full-time. So full-time would be about 40 hours a week or more, depending on the specific department they are in. So now we are going to talk about hiring or job outlooks for healthcare department managers. So the jobs in healthcare and medical management jumped from 22% from 2010 to 2020. This is well above the 14% normal range of jump. They actually only had a projected 14% jump in 2014, which is the normal average jump for any type of career. And this is largely in part, and I guess thanks to the baby boom population ages and people remain active in their life. There should be an increased demand for healthcare services. So now here are some recommendations. This list is actually where I got all of my information from. So if there's any information that you want, I would recommend any of these sources. They are great and they give a really nice outlook on everything that you would need to know about this career. So I just want to thank you all for tuning in today. And I just hope you have a better outlook on this career. Thanks.